available, we discussed about some anti-epileptic drugs like phenobarbital, benzodiazepines, immunostimulants like carbamazepine, oxcarbazepine, acecarbazepine, also the hydroxyzine, that is phenytoin, aromatic carboxylic acid like natric acid. Today, we are going to discuss all the rest of the anti-epileptic drugs available, like phenyldiazepine, which include lamotrigine, cyclic GABA analogs like gabapentin and pregabalin, and the newer anti-epileptic drugs present like levetiracetam, zonisamide, vigabatrin, and others. So, coming to lamotrigine. Lamotrigine is basically an anticonvulsant having carbamazepine-like action. How does carbamazepine act? Like carbamazepine acts on the sodium channel. They prolong the inactivated state of the sodium channel. Likewise, this lamotrigine they also prolong the sodium channel inactivation, and thus they are suppressing the high frequency firing of the sodium channels. Now, other than that, it also directly blocks the voltage sensitive sodium channel, and thus they prevent the release of excitatory neurotransmitters like glutamate and aspartate, and thus they are decreasing the neuronal excitability. This may account for a broad spectrum of anti-seizure activity. Where they are used generally as an add-on therapy in refractory cases of partial seizure and TTCS. They can even be used as monotherapy. And they are also effective in the absence seizure, myoclonic seizure, and kinetic seizure. Well absorbed orally, metabolized completely in the liver, plasma half-life 24 hours. But this reduces to 16 hours with the co-administration of phenytoin, carbamazepine, or phenobarbital. Now, side effects: sleepiness, dizziness, diplopia, ataxia, vomiting. They are better tolerated than carbamazepine. Now, coming to gabapentin. Gabapentin is a cyclic GABA analog. What are they called? Is basically a lipophilic molecule. They crosses the blood-brain barrier and they enhance the GABA release. And thus, more GABA is available to act on the GABA chloride channel. Okay. Other than that, they have been found recently to modulate a subset of neuronal voltage sensitive calcium channel. And what does it cause? It causes decreased entry of calcium into the presynaptic neuron, causing decrease in the glutamate release. And thus they are also suppressing neuronal excitability. So two functions are there. Number one thing, they are enhancing GABA release and they are reducing glutamate release. কোন অ্যাকশনটা অ্যান্টিকনভালসেন্ট বা সেডেশন করে জানা নেই. It can be due to enhance GABA action, it can be due to reduce glutamate release. Now, usage of gabapentin is the first line drug in refractory cases of partial seizure with or without generalization. Refractory মানে যখন ফার্স্ট লাইন ড্রাগ থেকে কাজ হচ্ছে না তখন সিজারটা পারসিস্ট করতে থাকে, then we can think of it. So, it's the first line drug to reduce seizure frequency in the refractory partial seizure with or without generalization. They are effective in both simple partial seizure and complex partial seizure and also in the DDCS. And it is also, other than that anti-epileptic use, they are also effective in the neuropathic pain or diabetic neuropathy, herpetic neuralgia, and others. They are also got role in the prophylaxis of migraine, and they can be used as an alternative drug for COVID states. পরীক্ষাতে কিন্তু কোশ্চেন আসতে পারে, আগেও বলেছিলাম কি অ্যান্টি এপিলেপটিক ড্রাগের নন এপিলেপটিক ইউজটা কি কি আছে. So gabapentin is one of the example. Carbamazepine is one of the example. Valproic acid. They are used other than the epileptic use. Okay. Gabapentin in neuropathic pain. Carbamazepine in trigeminal neuralgia. Valproic acid in migraine. Topiramate in migraine. So they have got prophylactic effect in migraine also, and they have used as an alternative drug for phobic states. Now, no drug interaction. Most of the anti-epileptic drugs we see, they show drug interaction because they influence the metabolizing enzymes, microsomal enzymes. But gabapentin, they do not show any drug interaction, and no changes in the dose of primary anti-epileptic drug is required when gabapentin is co-administered. Okay. Side effects: mild sedation, tiredness, dizziness, and unsteadiness. Pregabalin. Pregabalin is a newer congener of the gabapentin. Pharmacokinetic, pharmacodynamic properties are almost the same. Now, they are particularly used for neuropathic pain, like diabetic neuropathy, like herpetic neuralgia, chronic regional pain syndrome, and other types of chronic pain. It is claimed that sedative effects are lower than that of gabapentin, but poor concentration, rashes, and allergic reactions have been complained. Levetiracetam. Levetiracetam is clinically efficacious. Clinically efficacy has been demonstrated as an adjuvant medication as well as monotherapy. Like a new onset seizure, সেখানে কিন্তু levetiracetam use করা যায়. In refractory partial seizure with or without generalization. Now, how does it act? Mechanism of action is not very clear. Possibly, it binds to ASV2A, that is synaptic vesicular protein 2A. ASV2A, this may alter release of glutamate and or GABA from the synaptic neuron, from the synapse, thereby exerting anti-seizure effect. They also inhibit any type of calcium channel and thus affect intracellular calcium release. Like gabapentin or pregabalin, they are free of any drug interaction as they are neither oxidized by cytochrome P enzyme nor inhibit or reduce the enzyme. Side effects are few like sleepiness, dizziness, weakness, and rarely behavioral changes. They are increasingly used in partial seizure, in the myoclonic epilepsy, mainly as an add-on drug because of good tolerability from the first line drugs. For DTCS and absence seizure, it is a second line adjunctive drug, not approved for use in children below 4 years. Topiramate. Topiramate, they have got weak carbonic anhydrase inhibition activity, and they act by multiple mechanisms like phenytoin and carbamazepine. They prolong the inactivated sodium channel. They potentiate GABA action by a post-synaptic effect. They antagonize certain glutamate receptors, NMD, and they cause neuronal hyperpolarization to the potassium channel. These are the four mechanisms by which the topiramate is active. Indicated as a monotherapy or add-on therapy in refractory temporal partial seizure, complex partial seizure, and DTCs. They have got also effect in the myoclonic epilepsy as well as add-on drug in the absence seizure. Adverse effects: impairment of attention, sedation, ataxia, word-finding difficulties, and others. They cause paresthesia and renal stone because of the carbonic anhydrase inhibitor activity. Approved for prophylaxis of migraine. May be used when beta blockers and other prophylactics are not indicated or contraindicated or ineffective. Zonisamide, the newer anti-epileptic drug, it has also got weak carbonic anhydrase inhibition activity like that of topiramate. Now, mechanism of action: prolongation of sodium channel inactivation like phenytoin and carbamazepine, and they also suppress P-type calcium channels in certain neurons like etosuximide, valproate. When isotrodontic mainly excreted in urine, half-life more than 60 hours. Indicated as monotherapy as well as add-on therapy in refractory partial seizure with or without generalization. They are also effective They have also been tried in absence seizure. Why? Like ethosuximide and valproic acid, they also suppress things like calcium channels. So they have been tried in absence seizures and they are effective. Adverse effects somnolence, dizziness, headache, irritability, anorexia. Metabolic acidosis and renal stone because of weak carbonic anhydride inhibition activity. Should be avoided in patients sensitive to sulfonamides because of sulfa allergy. No drug interactions have been observed. Lacosamide is again a newer anti-epileptic drug. Now, it is effective as an add-on therapy of partial seizure without generalization. They act by enhancing sodium channel inactivation and thus suppressing repetitive firing of the neurons. No alteration in dose of companion anti-epileptic drug is needed because it neither induces nor inhibits drug metabolism enzymes. Diagabine. Diagabine basically it inhibits or blocks the GABA transporter GAT1 and thus what does it cause? It removes the synaptically released GABA into the neurons and the glial cells. যেগুলো GABAটা presynaptic neuron দিয়ে রিলিজ হচ্ছে এগুলোকে আবার কিন্তু presynaptic neuron basically because of blocking of GAT1 that is GABA transporter এই synaptically released GABA এই neurons and glial cells আবার introduce করে দিচ্ছে. So they are more GABA is available as they are blocking GABA transporter. The synaptically released GABA is not taken up by the presynaptic neurons and hence more GABA is available to act on the GABA benzodiazepine receptor and thus they are potentiating the GABA action. Currently it is approved only for add-on therapy of partial seizure with or without secondary generalization. Why the battery? That is gamma vinyl GABA. Basically, they are inhibitor of GABA transaminase. GABA transaminase is responsible for metabolism of GABA in the synapse. So, as they are inhibiting GABA transaminase, more GABA is present in the synapse to act on the GABA benzodiazepine receptor. Thus, they are again potentiating the GABA action. Effective in many patients with refractory epilepsy, especially complex partial seizure, and they are also effective in infantile spasm. Approved only for adult medication. Because of effect on the eye, visual field contraction, alteration of color vision, paresthesia, behavioral change, their use has been restricted only for the reserved drug. Treatment of epilepsy. At an epilepsy patient, key principle দিয়ে আমরা epilepsy treat করব. Number one thing, anti-epileptic drugs আমরা জাস্ট সিম্পটোম্যাটিক ট্রিটমেন্ট করছি একটা সিজার হচ্ছে তাকে সাপ্রেস করার চেষ্টা করছি বাট উই আর নট কিউরিং দ্য কজ সো অ্যান্টি এপিলেপটিক ড্রাগস সাপ্রেস দ্য সিজার বাট দে আর নট কিউরিং দ্য ডিসঅর্ডার though the disease may fade out after successful control of the seizure after over years. Now what the aim of the therapy? Aim of the therapy is to control seizure and to prevent seizure at the maximal level without any major side effects. The cause of epilepsy should be searched in the patient definitely, and if the cause is treatable, that should be treated. General principles: the choice of so many anti-epileptic drugs are available. So the choice of drug depends on the type of seizure. Whether it's a simple partial seizure, complex partial seizure, or the DPCS, it's a myoclonic epilepsy, or atonic seizure, or the absence seizure. Depending on the type of seizure, the choice of drug should be made, and definitely on the individual of the patient. Individual patient. At a young patient, a choice of drug থাকবে. At a pregnant mother, a choice of drug থাকবে. So on the seizure type and the need of individual patient. There is a trend to prefer newer drugs, anti-epileptic drugs. Why? Because of fewer side effects, because of less drug interaction. But these are less studied, and the older drugs are more studied. We are more comfortable with it. Initiate treatment early, as each seizure episode increases the propensity to further attacks. We start with a single drug with a lower dose. gradually build up the dose till the full control of seizure is achieved or till the side effect appears. So, you start with the single drug, preferably at low dose, gradually increase the dose till full control of seizure is achieved or side effect appears. Now, if full control is not achieved at the maximal tolerated dose, then we can think of substituting the drug with another drug. Not we are adding, we are substituting with another drug. And how? The first drug which was being given, that has to be decreased gradually, and the second drug should be started at a lower dose and the dose is gradually built up. এটা কিন্তু প্রসিজার গ্র্যাজুয়াল হবে। Suddenly withdraw করলে কিন্তু patient may go to status epilepticus. So if full control is not achieved, substitute another drug. For changing one epileptic drug to another, dose of first drug should be gradually reduced and that of the second drug gradually increased till the second drug regimen is fully established. Use combination therapy only when the monotherapy fails. And how to choose the combination therapy? The two drugs should be of having different mechanism of action. এখানে কিছু দেখি সামনে চলে যাবে তোকে বলছি সামনে চলে যাবে লাস্ট সেকেন্ড বেঞ্চ সাইড তোমাকে রে সামনে চলে সামনে চলে এখানে বস কম্বিনেশন থেরাপি ইউজ করা হবে যখন মনোথেরাপি ফেল করবে ঠিক আছে and the two drugs should be combined with different mechanism of action like one is acting on the sodium channel one is acting on the GABA or the glutamate when therapy with two drugs fail to achieve adequate control of seizure addition of third drug will not do much help unless the patient is suffering from more than one type of seizure. A single tonic-clonic seizure in a patient without any precipitating factor like stroke or the cerebral trauma and others, without any precipitating factor, may not merit initiation of anti-epileptic therapy. মানে একটা পেশেন্ট যার প্রথমবার এপিলেপসি হয়েছে তার কোনো কারণ নেই এপিলেপসি হওয়ার কোনো সেকেন্ডারি কজ নেই সেই ক্ষেত্রে কিন্তু অ্যান্টি এপিলেপটিক ড্রাগ থেরাপিটা ডিলে করা যায় বাট at the second time then we should definitely start the anti epileptic therapy যদি কোনো সেকেন্ডারি কজ থাকে তাহলে ডেফিনেটলি স্টার্ট করতে হবে therapeutic regimen should be as simple as possible all drugs withdrawal should be gradual because if there is any abrupt drug withdrawal the patient may go into status epilepticus. And what is the duration of therapy? Therapy may be lifelong or at least 3 years after the first seizure. One patient is favorable withdrawal করা যেতে পারে after 3 years. If the patient is having childhood epilepsy, absence of any family history, primary DTCS, recent onset at the start of treatment, absence of any precipitating factor, cerebral disorder, and there is normal interseizure EEG. এগুলো ফ্যাক্টরস রয়েছে যেখানে কিন্তু আমরা যদি প্রেজেন্ট যদি অ্যাবসেন্ট থাকে তো ড্রাগ উইথড্রয়ালটা আমরা 3 বছরের মধ্যে পরে 3 বছর পর চেষ্টা করতে পারি কিন্তু একটা পেশেন্টের যদি ফ্যামিলি হিস্ট্রি পজিটিভ থাকে বা কোনো সেকেন্ডারি কজ রয়েছে তাহলে কিন্তু পেশেন্ট মে রিকোয়ার লাইফটাইম থেরাপি dose regulation may be facilitated by monitoring of steady state plasma drug level basically most of the anti-epileptic drugs they show drug interactions and that is why therapeutic drug monitoring is very important. Why? Because therapeutic range of concentration has been studied for many of the anti-epileptic drugs. There is marked inter-individual variation in plasma drug concentration with the same dose. একটা মানুষের একটা ডোজ দেওয়ার পর একটা ড্রাগ লেভেল রয়েছে অ্যান্টি-এপিলেপটিক ড্রাগে সেকেন্ড মানুষের কিন্তু আলাদা থাকতে পারে। So a marked inter-individual variation and compliance to the drug is often poor. That is why therapeutic drug monitoring may be better. Now, when women is on anti-epileptic drug, if she conceives, then what we can do? It should never be stopped. Why? Because withdrawal of the anti-epileptic drug can make the women go to status epilepticus. Our anti-epileptic drug will be সমস্যা because of teratogenicity. It can cause harm to the fetus. Teratogen cause fetal Huntington syndrome. Valproate cause neural tube defects. These are the common neural tube and common teratogenicity we are facing with the use of anti-epileptic drugs. Now, a female on anti-epileptic drug, if we withdraw the anti-epileptic drug, then the patient can go to status epilepticus, and that can cause trauma to the fetus, and that can cause malformation. So, it is advisable not to withdraw anti-epileptic drug from a pregnant mother. We can cautiously try to reduce the dose. And again, if the woman is on valproate, then we can try to substitute valproate with other drug. And very important, a pregnant mother on anti-epileptic drug, we should give prophylactic folic acid supplementation in the second and third trimester of pregnancy to prevent neural tube defects. And we should also supplement vitamin K in the last month of pregnancy to prevent bleeding disorder in the neonate. A seizure episode does not require any drug treatment. After patient seizure DSC, he or she is on ongoing seizure activity. The primary concern is to look for ABC. Like any other medical emergency, we should look first for ABC, that is airway, breathing and circulation. The patency of airway should be looked for, adequate oxygenation should be made, and definitely pulse, blood pressure and others should be looked cautiously first. During ETCA, the first priority is to be given to prevent injury to the fall or biting. The patient should be put in the prone position or the lateral position so that respiratory secretion does not block the airway. And then we should definitely look for the patency of the airway. Attack usually passes off in 2 to 3 minutes, but the patient may not be roadworthy for a couple of hours. Now, these are some of the choice of anti-epileptic drugs. Like in case of partial seizure, the first line drugs are carbamazepine, valproic acid, lamotrigine, or carbazine. Alternative drugs are levetiracetam, fluvaxin, phenytoin, gabapentin, topiramate. In case of generalized tonic-clonic seizure, valproic acid, lamotrigine, carbamazepine. Absent seizure, valproic acid, etosuximide. Although the drug of choice in absent seizure is valproic acid. Myoclonic seizure, valproic acid, alternative drugs are topiramate and levetiracetam and lacosamide. Atonic seizure, valproic acid, lamotrigine. Febrile convulsion, perfrintodiazepam is the drug of choice in febrile convulsion. Steroid epilepticus, the drug of choice are intravenous lorazepam and intravenous diazepam. Phosphenytoin is also used. Now coming to febrile convulsion management. What do we mean by febrile convulsion? Generally, it is seen in children below 5 years. When the child suffers from fever, because of the fever, the seizure develops. Okay, so some children, especially under 5 years, develop convulsion during fever. Seizures may recur every time with fever, and few may become chronic epilepsies. Now, in those patients, the fever should be aggressively treated so that we can prevent the seizures with paracetamol and external cooling. Now, if a child is suffering from febrile convulsion, the best treatment is, as said earlier, per rectal diazepam at a rate of 0.5 mg per kg. The intravenous preparation is used only when the protected diazepam formulation is not available. In recurrent cases or those at particular risk of developing chronic epilepsy, intermittent prophylaxis with diazepam can be started at the onset of fever. Infantile spasm, that is dysarthria, therapy of this condition is very unsatisfactory. Anti-epileptic drugs are generally useless. Corticosteroids, they afford symptomatic relief, but they are not used for the long term because of side effects. Clonazepam, valproate, vigabatrin may afford some relief, not complete. Status epilepticus. Did it? Hello? Hello? Now coming to status epilepticus. What do you mean? Status epilepticus माने कि either the patient is having seizure persistent for 30 minutes, more than 30 minutes. तो একটা বা তার বেশি seizure হচ্ছে for more than 30 minutes. Number one. Or between two seizure activity, the consciousness is not regained in between. That is called status epilepticus. দুটো কন্ডিশন রয়েছে। তার মধ্যে একটা বিট করলেই কিন্তু status epilepticus. When seizure activity occurs for more than 30 minutes or two or more seizure occurs without recovery of consciousness. This is called status epilepticus. It's a medical emergency condition and that should be managed aggressively. Now, recurrent DTCS without recovery of consciousness in between is a medical emergency which have to be controlled to prevent death and to prevent permanent brain damage. Now, management of status epilepticus. As said earlier, for any medical emergency, the first priority is airway breathing and circulation. So, patency of airway, that is very utmost important. We also maintain the airway oxygenation, if required incubation and ventilation, fluid and electrolyte balance, blood pressure, normal cardiac rhythm, euglycemia. Some patients of hypoglycemia, they may present seizure. So, if there is hypoglycemia, we should correct aggressively. Euglycemia is care of unconscious patient. Now, what is drug of choice? The drug of choice is intravenous clonazepam. Okay. Initially, it was intravenous diazepam, but that has been replaced by intravenous clonazepam. Why? Because number one thing, diazepam is more lipophilic, so they show features of redistribution, and their action fades away generally in 20 minutes. But as lorazepam is less lipophilic, its action does not show redistribution phenomena, and its action persists for 6 to 12 hours. It is the number one advantage. Number two, diazepam intravenously is damaging to the injected vein, while lorazepam does not cause it. These are the two advantages for which intravenous lorazepam is preferred over intravenous diazepam in patients of status epilepticus. Now, diazepam and lorazepam is effective in 75 to 90% of the cases, and they produce a more sustained anti-convulsant effect. Diazepam injected intravenously was the standard therapy till recently. Irrespective of the response to lorazepam or diazepam, fosphenytoin intravenously should be administered under continuous ECG monitoring. ठीक है सर? है ना? We know lorazepam is a benzodiazepine or diazepam is a benzodiazepine, and they show the features of tolerance. So, patient over lorazepam or diazepam, the patient should be administered intravenous fosphenytoin. This will suppress seizures that have not responded to lorazepam and pave the way for the long-term treatment. Now, phenytoin sodium should be used intravenously only when intravenous phosphates is not available. What is the difference between the two? Phenytoin is damaging to the injected vein, while phosphates does not cause it. It can be administered at a faster rate compared to phenytoin. Phenobarbital is another slower acting drug which can be used as an alternative to phosphates or when the latter is ineffective. Refractory cases who do not respond to phosphates or phenytoin and phenobarbital, they can be treated with intravenous midazolam, propofol, or even thiopentol anesthesia, with or without fluoridation or muscle relaxation. Now we go through some of the MCQs on the anti-epileptic therapy. Number 1. Which of the following statements about the anti-epileptic drug is false? Phenytoin and carbamazepine act by prolonging the inactivated state of sodium channel. It is true or false? Communicate. Or is it durable? Durable. True হবে। ঠিক বলছে? Actingus. Yes, the phenytoin and carbamazepine act by prolonging the inactivated state of sodium channel. Is the main mechanism of action. Carbamazepine can be used in trigeminal neuralgia. Second bench. Carbamazepine can be used in trigeminal neuralgia. Yes or no? Huh? No. Next. What? True. Yes. Carbamazepine can be used in trigeminal neuralgia. It is one of the non-epileptic use. Diazepam is an anticonvulsant drug. False. 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 Are we not using diazepam, lorazepam in the status epilepticus? It's an anticonvulsant drug. Lamotrigine mainly acts by causing GABA-mediated chloride channel opening. True or false? False. It acts by prolonging the sodium channel inactivation. Next question. Granulocytopenia, gingival hyperplasia, and the facial hirsutism are all the possible side effects of one of the following anticonvulsant drugs. From the back. কোন ড্রাগটা হবে? এটা যে একটা পিকচার দেখিয়েছিলাম, একটা জঙ্গল having gingival hyperplasia. Next. এই বেঞ্চে কি বলতে পারবে? তারপরে বেঞ্চ। Next. কি বলতে পারবে? It's not valproate. It's phenytoin. The commonest toxicity of phenytoin therapy is gingival hyperplasia or gum hyperplasia, but more seen in the younger population. And how to prevent it? To prevent it by good oral hygiene. Okay. Facial hirsutism with phenytoin therapy seen more in the younger girls, And granulocytopenia can also be seen because of hypersensitivity reaction to the penicillin. Side effect of carbamazepine is more is those related neurotoxicity like dizziness, ataxia and others. A patient on penicillin therapy, developed depression, for which he was prescribed tricyclic antidepressant. He now complains of lassitude and his hemoglobin reading is 8 gram per cent. The next step in the management of this patient is কি হবে এটা টপ হয়ে যাচ্ছে না basically penicillin patient on penicillin therapy it is prescribed tricyclic antidepressant there is a drug interaction tricyclic antidepressant basically they inhibit CYP2C19 and penicillin is hydroxylated by this beta enzyme so there is patent toxicity and what does patent do because it also cause megaloblastic anemia by inhibition of the absorption of folate and increasing its excretion. Okay, so if it megaloblastic anemia, the MCV will rise. So MCV should be estimated. हो जाएगा से? Now, first about the mechanism of action of anticonvulsants. Ethosuximide, rapidogrin, potassium channelophenol, ये बोलते वाली. How does ethosuximide act? It acts by blocking or inhibiting T-type calcium channel. That is false. Phenytoin, yes. The sodium channel blocker. It blocks the inactivated state of sodium channel. Diazepam, yes, is a benzodiazepine. It acts on the GABA benzodiazepine receptor. So it facilitates GABA action. Gabapentin, yes, it increases GABA release. Drug of choice for absence seizure. Very well. Valproic acid. Valproic the drug of choice, phenytoin, no dose, even it can exacerbate it. Diazepam, no dose, ethosuximide definitely is helpful in absence seizure, but valproic is the drug of choice. Drug of choice is complex partial seizure. Sorry? Carbamazepine, good. Carbamazepine is the drug of choice in complex partial seizure. Which of the following drug is used in status epilepticus? Lorazepam by intravenous route is a drug of choice. If they would have been diazepam instead of lorazepam, that would have been the answer. If the two drugs would have been given, diazepam IV, lorazepam IV, then lorazepam would have been preferred. All of these are adverse effects with carbamazepine except teratogenicity, neurotoxicity, decrease in ADH, hypersensitivity. কোনটা হবে? এই কইরো থেকে কে বলতে পারবে? পিছন থেকে অ্যানিমাল আর জোরে বল yes it decrease in ADH carbamazepine definitely it causes teratogenicity although low but when combined with valproic acid teratogenicity is high in carbamazepine neurotoxicity is the most common side effect and the decrease in ADH no is the other thing there is potentiation of ADH effect carbamazepine it enhances the ADH effect causing retention of water and hyponatremia hypersensitivity can be seen with carbamazepine therapy. A patient Rama was diagnosed to be having febrile convulsion in the pediatric emergency. Which of the following can be used for the treatment of this patient? He will be. For rectal diazepam. Raju, a 10-year-old boy, is having difficulty in learning at school. He has short lapses of awareness with eyelid fluttering that occur every 5 to 10 minutes. EEG studies reveal sleep 3 Hz spike and wave discharges appearing synchronously. Which of the following drug would be effective but has a disadvantage that it can cause sedation and tolerance? Type of epilepsy. Type of epilepsy. It is what do we mean by absent seizure? Absent seizure basically children with দেখা যায়। For example, একটা টিচার একটা ছেলেকে তুলে বললো কি এই প্যারাগ্রাফটা পড়। প্যারাগ্রাফ বলতে বলতে মাঝে মাঝে কিছুক্ষণের জন্য একটা বন্ধ হয়ে যাচ্ছে and he is staring aimlessly just for a second, then again he is starting the paragraph. এটা মাঝে মাঝে হচ্ছে, that is absent seizure. That is not that is unknown to the child, but that is looked by the teacher. একটা aimlessly staring or inhibition of any motor activity for just a few seconds, more seen in children. So basically এখানে কি দেখা যাচ্ছে, he has short lapses of awareness with eyelid fluttering that occurs every 5 to 10 minutes. And the characteristic EEG finding in the absent seizure is 3 Hz spike appearing in recurrent intervals. So, it is a case of absent seizure. Now again it is saying which of the following drugs would be effective. So, what are the drugs effective? We know valproic acid is there, we know ethosuximide is there, and there are certain other drugs also, like benzodiazepines, clonazepam. Clonazepam is also effective in the absent seizure, but as a disadvantage that it can cause sedation and tolerance. So basically the answer is clonazepam. Okay.
Today my topic is Neisseria. So Neisseria, two types of Neisseria organisms are Neisseria meningitis, Neisseria contagion. Okay. অনেক দূর থেকে I don't know whether you can see or not. আমার চোখ ভালো থাকতে পারে। So it is cumulative diplomacy arranged in pair. So it is called GND, cumulative diplomacy. Neisseria meningitis and Neisseria gonorrhoeae, it is also cumulative diplomacy, but a big difference in the structure. You can see these are diplomacy, cumulative, so they in color. These are also diplomacy, but adjacent sides are flat, and this is convex. So they know convex. This is Neisseria meningitis and Neisseria gonorrhoeae. Adjacent sides are concave, V-shaped or bean-shaped. Okay, this is the difference which we can see under microscope to differentiate whether it is Neisseria gonorrhoeae or meningitis. Now, it was first isolated by German physician Neisser. First he observed it in the gonorrheal pus. He was a dermatologist and doctor of venereal disease. So, in case of gonorrheal pus, he observed this type of organism. So, according to his name, it is called Neisseria gonorrhoeae and Neisseria meningitis. Now, I first start Neisseria meningitis. You can see the morphology that diplococci, gram-negative diplococci arranged in pair and adjacent sides are fat in case of Neisseria meningitis, and it has capsule. Okay, it is capsule, but we cannot see the capsule always when it is fresh isolated. Just যখন না হয়েছে then I can see the capsule. Otherwise, we cannot see the capsule. And it has villi. It has villi. Villi is for attachment. বলেছি সাধারণ ভাষায় যেমন লাই থাকে, by which it can injure the host or it will be fixed to the host cell. আগে তুমি যেটা ফিক্স করতে হবে, then it will multiply. It has villi, which is made of villi protein, and it has capsule which is lipopolysaccharide. And as it is gram-negative, you know gram-negative produces endotoxin. So it has endotoxin also, and gram-positive, you know, which secretes exotoxin. So it has endotoxin. And what are the virulence factors? Virulence factors is it has IgA. And APS lipopolysaccharide IgA it splits the IgA immunoglobulin which lies at the mucous membrane, and it gives protection to the mucous membrane. So if it can be split, but IgA splitter which is present in case of meningococcus. So IgA will be inactivated. So mucus protection will be inactivated. Then it can work better as immunity is lost. And from the very beginning, you know, though you have not started medicine, you know that this is called the meningitis. Meningitis, very common meningitis. Now, very important causes, what are the bacteria or virus or organisms causing meningitis? It is one, Neisseria meningitis. Other, as I am telling, it is very important questions, Neisseria meningitis. As it is at different stage, different types of organisms are responsible for meningitis. In newborn or infant, the positive agents for meningitis is, anyone can tell? Streptococcus, would be Streptococcus agalacti. You have heard name. Would be Streptococcus agalacti. Then Streptococcus pneumoniae. Then Listeria, E. coli. E. coli is responsible for meningitis in newborn, not for adult. So E. coli, Streptococcus pneumoniae, then Streptococcus agalacti, Haemophilus influenzae, and Listeria. So what is that? They will not cause meningitis in adult. This is for newborn or infant. And after that age, in children, the positive agents are Haemophilus influenzae, Listeria, Streptococcus and Neisseria meningitis. Now coming Neisseria meningitis. So Neisseria meningitis is not causing infection in the newborn. In adult are also suffering from Neisseria meningitis and Streptococcus pneumoniae mainly, then Listeria also and Haemophilus also. Now this meningitis. Now pathogenesis. Pathogenesis infection is caused by droplet infections. When sneezing, coughing from a nearest person, you are talking to a person who is suffering from, especially the children, when they are in the school, very close sitting and doing. So, by the droplet, during infection, meningococcus may enter. So, pathogenesis. First, droplet infection. Then it goes to the nasopharynx. Then go to the nasopharynx together, and by the help of pili and some ligand which are present on the outer membrane, it is attached to the posterior space. From there, via the sheath of olfactory nerve, it is going to the filiform plate. তোমরা অ্যানাটমিটা জানো যে মেসোফেরিংস থেকে ফার্স্ট হচ্ছে ফিলিফর্ম প্লেটে যাচ্ছে, then it is going to the base of the skull. Okay, in the subarachnoid space. And you know the anatomy, there are three layers, you know, that is pyometer, duometer, arachnoid. In the subarachnoid space, bacteria is used. Okay, they will multiply there with quick multiplication in the CSF, and it will cause meningitis. So meningitis is the infection of the covering of the brain, that is meninges along with the covering of the spinal cord. Acute name is so it is the disease of the meninges along the covering of the spinal cord. Okay, so that is meningitis. So where nasopharynx, filiform plate, then ultimately base of the skull. But some will reach in the nasopharynx. From there, higher blood, it will reach in the circulation of the blood. Then it is called meningococcemia. So now meningococcus in the blood. So it is called meningococcemia. It ultimately causes meningitis, but it is moving in the blood. Meningococcemia. It will cause severe symptoms, severe headache, projectile vomiting, and there will be convulsion, seizure, coma, and ultimately, if not treated quickly, patient will die after meningitis, especially in the newborn. বাচ্চারা মারাই যাবে যদি if there is no quick diagnosis. তোমরা ডায়াগনোসিস জানো, তুমি মেডিসিন আউটডোর দিয়ে দেখেছো কি কি করা হয় মেডিসিনে। it is the make easily পেশেন্টকে বলা হয় টাচ করো চিপ করতে পারবে না due to insensitivity. Then chronic sign is positive. Okay, so necessity positive and delirium, ভুল বকছে পেশেন্ট, disorientation, seizure, ঝাঁকুনি হচ্ছে, কাঁপুনি হচ্ছে, এদেরকে সো ক্লিনিক্যাল ডায়াগনোসিস ভেরি ইম্পর্টেন্ট। সবসময় আমরা সিএসএ তথ্যই পাই না, কিন্তু পেশেন্টের হিস্ট্রি সার্ভে ডাটা, তারপর এই সিম্পটমগুলো দেখে we can diagnose case. It may be a case of meningitis. তারপর আমরা কিন্তু সিএসএ নিয়ে টেস্ট করি। So meningococcemia when it is in the blood, তখন কিন্তু একটু বেশি সিভিয়ার সিম্পটম হয়। There will be fever, জ্বর হবে। ওকে, fever and slight seizures and slight delirium etc. And when it is in the blood, what is the problem? It will go to the endothelial lining. Capillary endothelium এর মধ্যে যেহেতু ব্লাডের মধ্যে তাহলে কি হবে? There will be destruction of the endothelial tissue due to necrosis of the vasculature. That is vasculitis, necrotizing vasculitis. Sometimes it may be severe. ভীষণ হতে পারে। There is severe hypertension and leaking of the blood. তখন বাইরে স্কিনের বাইরে ব্লাড আসলে কি দেখবো আমরা? Blood response দেখবো। Petechial hemorrhage. This is what petechial hemorrhage. স্কিনে আমরা blood response দেখতে পাবো। আর কি হবে? As there is destruction of the vasculature, it will lead to severe hypotension and a severe fatal condition which is called Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome, severe fatal condition. There will be DIC that is disseminated in the vascular population, which may lead to death of the patient. This is the vascular. I will show you the picture. So this is the pathogenesis. Now I will go for diagnosis. Now, one important difference factor which is related to only Neisseria meningitis that it has different antigenic character which helps in serodiagnosis. মানে এক meningitis এর মধ্যে অনেক রকম ভাগ হতে পারে। যেমন ডেঙ্গুতে তোমরা জানো ডেঙ্গু 1, ডেঙ্গু 2, ডেঙ্গু 3, ডেঙ্গু 4, ডেঙ্গুতে এখানে ভাইরাস বলা হয়। হ্যাঁ, একটা ডেঙ্গুরই অনেক রকম টাইপ আছে। If you are suffering from dengue 1, then immunity against dengue 2 will not give you protection. Again, and it has different types of antigenic or serotypic component. That is, and it is important. A, B, C, D. E29, X, Y, J, W1, 35, and another H, I, K, L, etc. Total 13 serotypes are there. তাহলে যদি আমরা meningitis হয় আমি যদি ভ্যাকসিন ইউজ করি আমি যদি A সেরোটাইপ দিয়ে meningitis হয়ে থাকে আমি B ভ্যাকসিন দিয়ে কিন্তু কাজ করব। As there are 13 different serotypes. তাহলে meningitis এর মধ্যে এতগুলো ভাগ আছে। Okay, so there are A, B, C, D, E29, X, Y, Z, W15 and H. This is not important, but this one important, and these are important serotypes. So vaccines are prepared not or against all the several vaccines are available. Some of them vaccine পাওয়া যাচ্ছে না, only W135 against these vaccines are available. কেন বলছি যেহেতু বাচ্চাদের আমাদের ভ্যাকসিন আছে কিন্তু ভ্যাকসিন এখন পাওয়া যায় না, শুধু ইম্পর্টেন্ট কয়েকটা রেজিস্টার ভ্যাকসিন পাওয়া যাচ্ছে। Now I am going for pathogenesis. Lab diagnosis. তোমরা জানো যদি meningitis হয় আমি কি স্যাম্পল নেব? CSF ছোলা পাতা CSF নেব। কোথা থেকে নেওয়া হয়? নাম্বার কাউন্টার করে কোন এরিয়া? ইমিডিয়েট 3 to 4 3 4 4 5 সেখান থেকে নাম্বার কাউন্টার করে CSF is treated। তোমরা ল্যাব ডায়াগনোসিসে এই জিনিসটা ইম্পর্টেন্ট। which I am explaining. CSF, after taking CSF, it is divided into three parts. First of all, it should be immediately processed. CSF বেশিক্ষণ রাখা যাবে না. Immediately it should be processed in the laboratory. If not possible, then I have to enrich it by the glucose form. CSF নিয়ে সেটা glucose পথে নিয়ে যাবে. So first part, প্রথম তিনটে টিউবের মধ্যে CSF নেওয়া হয়. Okay. First part, it is centrifuge. প্রথম পার্টটা কি হলো? আমাদের কিন্তু এই ব্লাড ব্যাংক সেল তিনটে পার্ট করে লিখতে হবে. যখন CSF নাও, I will take it in three different ways. First tube, it is on microscopy. যেহেতু এটা লিকুইড, আমি স্যাম্পল ভালো পাবো না, সো ফার্স্ট I have to centrifuge it. Centrifuge করে ডিপোজিট যেটা এখানে পাবো, ডিপোজিট যেটা আমি পাবো, I take something from the deposit and prepare a slide, and after downstream I will see at a microscope. Downstream and keep our negative visible and adjacent sides are flat. So I will at that time I will confirm with my diagnosis that it will be Neisseria meningitis. So microscopy, downstream, and recent stain is fluorescent stain. As for quick diagnosis, fluorescent then antibodies is added with the sample, as sample containing antigen, and antibody is trained or tagged with fluorescent dye. So antigen antibody reaction will be fluorescence. Quick diagnosis in camera laboratory, it is very much possible, and it should be seen under fluorescent microscope in the dark room. Short term make it in a quick diagnosis, right? Solution. This is the deposit. From the supernatant fluid, আমি centrifuge করলে উপরে একটা fluid liquid থাকবে, সেই লিকুইডটা দিয়ে আমি কি করব, আমি ওখান থেকে ল্যাটেক্স টেস্ট করব, অ্যান্টিজেন অ্যান্টিবডি রিঅ্যাকশন অবশ্যই করব. সো from the supernatant কি করব, আমরা ELISA টেস্ট করব ফর অ্যান্টিজেন, কিংবা ল্যাটেক্স টেস্ট করব, or CREP, counter current immunoelectrophoresis. হ্যাঁ, এগুলো দেখেও আমি ওই অ্যান্টিজেন অ্যান্টিবডি রিঅ্যাকশনটা করতে পারবো. তাহলে এই জন্য বলছি যে আমার পেছনে আছো, আমি কিছু দেখতে পাচ্ছ না. তাহলে this is for first part. From the second part কি করব, কালচার. Second part का कितने निये की कोई है culture. Immediate inoculation in the culture. And की culture plate हो, as it is a delicate organism and very important to diagnosis is required. So special type of media is used. देखो media के लिए भी जो खाली होता है ना, हम এখন की nutrient data use করব না. की করব, blood agar and chocolate agar. So mainly blood agar and chocolate agar is used, and for beta bone 5 to 10% carbon dioxide containing atmosphere. Yes, so blood agar and chocolate agar with 5 to 10% carbon dioxide, and there are some special media or selective media, that is modified thymotin media. এগুলো আমি ব্লাড কালচারে আমি special CSF culture করব, and after adequate time of incubation, I will see small circular slight ammonated growth of the organism, which are grayish in color and margin is granular. So small circular grayish ammonated colony and with irregular or granular margin. এরকম হতে পারে. তাহলে তারপর কি করে আবার অনুমান করব, যে আমি কলোনি পেলাম সেটা কি করব, আবার কলোনি আমি ডাউনস্ট্রিম করে দেখব কি আমি গ্রাম নেগেটিভ অর্গানিজম পাচ্ছি কিনা, সেই কক্স পস্টুলেট কালচার থেকে আবার আমি কনফার্ম করতে পারবো তো ওখানে আমাকে কনফার্ম করে দিতে হবে সো ডাউনস্ট্রিম করে দেখবো whether it is really genetic নেগেটিভ নিউক্লিওটাইড কিনা তারপর কি নেক্সট বায়োকেমিক্যাল টেস্ট বায়োকেমিক্যাল টেস্ট কি এটার ইম্পর্টেন্স হচ্ছে এটা অক্সিডেজ অ্যারো রিং এগুলো হচ্ছে অ্যারো সো অক্সিডেজ উইল বি পজিটিভ oxidase positive, catalase positive. So oxidase positive, catalase positive, and biochemically আমরা কি করি গ্লুকোজ বিভিন্ন রকমের গ্লুকোজ ল্যাকটোজ ম্যাগনেটল এগুলো দিয়ে আমরা দেখি whether the organism can ferment it or not. Okay, here it is oxidative, so it is utilizing glucose in oxidative pathway. And এখানে স্পেশালি কি মেনিনেট is a he can ferment mannitol fermentation test for confirmation of the Neisseria meningitis. As mannitol is not fermented by the Neisseria meningitis, so দুটোই ডিপ্লোকক্টাইড আমরা কি করে ডিফারেন্সিয়েট করি by the help of mannitol fermentation. Mannitol যদি ফার্মেন্ট করে তাহলে বুঝবো it is meningitis, যদি না করে then it is Neisseria meningitis. So biochemical test has very important role. And recent diagnostic method এর apparatus এর নাম তোমরা বলতে পারো আমার এখানে হয় না culture antibiogram we are doing by Kirby power diffusion method তোমরা নাম শুনেছো হ্যাঁ but it is taking time and good method but as this is very delicate specimen CSF and very quick diagnosis and accurate diagnosis is required তাহলে কি করব অন্য যে অ্যাপারেটাস আছে তোমরা বইয়ে পড়বে তার নাম হচ্ছে ভাইকে এই ইনস্ট্রুমেন্টের সাহায্যে অটোমেটেড সিস্টেম ফর অ্যান্টিবায়োগ্রাম এর মধ্যে স্যাম্পলটা ঢুকিয়ে দিলে এটা অটোমেটিক কোন কোন ড্রাগের উপর সেনসিটিভিটি আছে এটা বলে Again, it is costly apparatus so not available everywhere. Our distribution মানে খাতা হাতে করে করি but it is latest method automated method আর লাস্টে তোমার যেটা সবসময় লেখা PCR for diagnosis PCR information that is molecular আচ্ছা নেক্সট হচ্ছে ট্রিটমেন্ট কি করা হয় না ভ্যাকুমাসিন তুমি ওটা যে রিজাল্টটা আগে আমরা ভ্যাকুমাসিন দিই ওটা রিজাল্ট মানে হাতে লাস্ট রাখা আছে প্রথমে কি দেবো পেনিসিলিন সেই শুরু থেকে পেনিসিলিন was the drug of choice ঠিক আছে কিন্তু অনেকের পেনিসিলিন রেজিস্ট্যান্স আছে ড্রাগ রেজিস্ট্যান্স অ্যালার্জি আছে নট রেজিস্ট্যান্স অ্যালার্জি আছে তাহলে তাদের পেনিসিলিন দেওয়া যাবে না তখন তাদের কি করা হয় সে থার্ড জেনারেশন সেপোজ করে দেওয়া হয় ঠিক আছে সেপ্টাজিন এগুলো দেওয়া হয় আর কি করা হয় অ্যান্টিস্টিন দেওয়া হয় সিপ্রোফ্লক্সাসিন দেওয়া হয় যাদের অ্যালার্জি টু পেনিসিলিন আদারওয়াইজ পেনিসিলিন দেওয়া হয় ঠিক আছে আর ভ্যাকসিন বললাম যে ভ্যাকসিনটা যেহেতু বাচ্চাদের ভ্যাকসিনটা দরকার কিন্তু বাট অল ভ্যাকসিনস এগেইনস্ট অল সেরোটাইপ ইজ নট available only A, C and W135 against these vaccines are available. So this is all for Neisseria meningitis. Now Neisseria gonorrhea. Neisseria gonorrhea. We have seen Diptobacter, pre-initiated or initiated. The adjacent sites are there, and it has capsule. Same thing, capsule is always not seen. Only in the fresh isolate we can see the capsule. Okay, capsule is the polysaccharide in nature. It is also pillide, which is composed of peeling protein, which helps in addition of the organisms with the cell wall of the host. And it has a special outer membrane protein. Peptide, it has a pillide, and cell wall has protein, outer membrane protein. Why is it protein? Outer membrane protein is called, which are three types. OMP1, outer membrane protein. OMP1, OMP2, OMP3, outer membrane protein. It is called pore protein. It is called pore protein. What that means? It causes pore formation. তোমরা কমপ্লিমেন্টে দেখেছো আলটিমেটলি হোয়াট ইজ হ্যাপেনিং, যখন কমপ্লিমেন্ট সিস্টেমের কমপ্লিমেন্ট কাসকেডের মধ্যে দিয়ে যাচ্ছে, লাস্ট কি হয়? ম্যাক ফর্মেশন, মেমব্রেন অ্যাটাকিং কমপ্লেক্স। মেমব্রেন অ্যাটাকিং কমপ্লেক্স কার মেমব্রেন? যে ব্যাকটেরিয়া বাইরে ঢুকলে আমাদের কমপ্লিমেন্ট আমাদের বডির সিস্টেম, তো কমপ্লিমেন্ট কি করবে? সে ব্যাকটেরিয়ার মেমব্রেনকে অ্যাটাক করবে। সবাই মিলে 1 4 3 5 6 7 8 9 সবাই মিলে কি করে কোড ফর্মেশন করে, সেলের গায়ে ফুটো করে দেয়, তাহলে সেলটা ড্যামেজ হয়ে যায়। ঠিক আছে, সেম ইট হ্যাজ OMP1, ইট ইজ কোডিং ইন নেচার। ওকে, কোড প্রোটিন, কিন্তু এটা হচ্ছে ব্যাকটেরিয়া। ব্যাকটেরিয়া হচ্ছে আমাদের বোথ সেলের কোড করে দিচ্ছে, তাহলে এর আলটিমেটলি এম হচ্ছে ড্যামেজটা হচ্ছে, তাহলে বাই pore formation it damages our cell. So it is pore protein. Number 3 is RLP protein. It is not so important. Number 2 is OPA protein. Is it okay? Okay. Number 2 is OPA. এগুলো আমাদের একটু জানতে হবে। OPA protein কি? It is causing opacity on the culture. যখন আমরা কালচার করব সেটা opaque হয়ে যায়। So this is due to the outer membrane protein of Neisseria gonorrhoeae, that is OPA protein, which causes opacity. Then third is not important, but these are helping attachment, ligand formation, attachment of the Neisseria gonorrhoeae to the erectile tissue. Okay, and by the pore formation destruction also. Now, what is the disease? Are যে সমস্ত growth factors are same like Neisseria medical disease, that is it has IgA inhibitor action, that is it cleaves or dissects the IgA, which is the protective layer, protective for the mucus lining. আমাদের যখন নাইসেরিয়া মেনিনজাইটিস থ্রোটে দিচ্ছে, থ্রোটের মিউকাস মানে প্রোটেকশন দিচ্ছে, আর যখন গনোকপাস হচ্ছে ইউরেথ্রা, সেটাকে মিউকাস মেমব্রেন আছে তার প্রোটেকশনের জন্য IgA আছে ফ্রম আওয়ার বডি, বাট the organisms are cleaving that, breaking that IgA. So IgA becoming inactive হয়ে গেলে সে লোকাল প্রোটেকশন দিতে পারছে না, then it can infect. So Neisseria gonorrhoeae disease is gonorrhea, and it is exclusively human disease. Okay, male female depending high. Females are very pregnant. Females sickness they may not suffer, but she spread infection to the partners. Okay. Now this is Neisseria gonorrhoeae and pathogens. Medication একটা pathogen ছিল, সেটা হচ্ছে droplet infection. এটা from the urethral discharge during sexual contact. So when one partner partner is suffering from the disease, the gonococcal will invade the urethral mucous membrane. Okay, it will invade and it will, by its virulence factors, it will penetrate the urethral mucous membrane and go to the sub-epithelial connective tissue. So it will reach sub-epithelial connective tissue of the urethra and cause inflammation of that area. Inflammation মানে কি হবে? Neutrophils or phagocytes will come, there will be tissue destruction and ulcer formation and huge amount of secretion. প্রচুর neutrophil আসে, প্রচুর pus formation হয়, and main complaint is discharging pus, both male and female. Male হবে automatic pus আসছে আর এটা female active problem. Female extra there will be dysuria and discharge of the pus through urethra. And it will involve the urethra mainly in female. It will involve the upper area, that is cervix. So there is urethritis, cervicitis. It may reach endometrium, endometritis. It may reach fallopian tube. Then inflammation of fallopian tube. Ultimately, there may be sterility also. Okay, and adjacent area, that is anal area, there is also abscess formation. Okay, this is female. In case of male, there is again urethritis, first urethritis, anarchism, urethritis, then prostatitis. It can reach epididymis. It can reach fallopian tube. Ultimately, there is sterility. If chronic case not properly treated, chance of sterility, and main problem in male, that is stricture of the urethra. Stricture, narrowing হয়ে যায়, fibrosis হয়ে যায়, and difficult micturition. Okay, so in male, there is problem is stricture if it is a chronic case and it is not treated properly. And another problem is in case of female, fetus. If pregnant mother is suffering from gonorrhea during delivery, the innocent fetus, which has no brain, when during delivery, if birth canal is infected during passage, the mucous membrane of the eye may come in contact with this pus, urethral pus, and it will cause ophthalmia neonatal. বাচ্চাদের ভীষণ চোখে ইনফেকশন হয়, পাস বলতে থাকে, চোখ খুলতে পারে না from the mother. So ophthalmia neonatal. Treatment is 1% silver nitrate solution topically application है, okay, shave and proper care, proper dressing, etc. And female PID also, pelvic inflammatory disease. Now blood diagnosis. Blood diagnosis की है वो तुम्हें आपकी the specimen pus or urethral discharge, both in case of male and in case of female also. Urethral discharge in male কি করা হয়, মর্নিং ড্রপ taken, মর্নিং যাওয়া হয়, and if scanty discharge, অনেক সময় ডিসচার্জ খুব কম আসছে, তখন কি হয়, you have to mention after prostatic massage. prostatic massage করা হয়, তাহলে সেখান থেকে কিছুটা পাস বেরিয়ে আসে. So after prostatic massage, pus is collected from the male mucus. Okay, and before that, cleaning of the mucus is done. And in case of female, there is also discharge is collected. First, mucus is cleaned and with the saline water, then discharge is taken. But as the organism is very delicate, সঙ্গে সঙ্গে মারা যায়, মানে বেশিক্ষণ বাইরে ড্রাই থাকলে অর্গানিজমটা ডেড হয়ে যাবে, তাহলে একটু কালচার করে কিছু পাবো না। তাহলে কি হয়, it is better to take the side at 20 days at the bedside. কি করে পেশেন্ট যেখানে আছে সেখানে আমরা 1 20 days নিয়ে যাব and platinum loop. Immediately after taking the discharge by the loop, I will inoculate at the bedside. ঠিক আছে, and we will prepare a slide at the bedside. তাহলে সঙ্গে সঙ্গে অর্গানিজমটা পেয়ে যাচ্ছি, কালচারের জন্য সঙ্গে সঙ্গে দিয়ে দিলাম, then I will take in the laboratory and incubate it. Okay. And so after gum stem, I see gum negative, diplococcus, kidney separate, W separate, and arranged it there. And it is important in case of niceroid, it is intracellular, GND, intracellular gum negative, intracellular diplococcus, and it lies within the neutrophil. তোমরা তো দেখতে পাবে না অপোজ থেকে, এখানে neutrophil, within the neutrophil under microscope we can see kidney separate diplococcus. So it is called intracellular diplococcus. Okay, but nicer mainly is there may be extracellular also, but it is diagnostic. If we see intracellular diplococcus plenty in number and plenty of processes are there, 95% diagnosis and confirmation is complete. Okay. অনেক সময় চাপের পেটে সেল থেকে বাইরে বেরিয়েছে, বাট ইউজুয়ালি এটা নিউট্রিফিল নিউট্রিফিল ফাংশন যারা নিউট্রিয়াল লো, সো ইট ইজ সিক দ্যাটস দ্য ডিফারেন্ট। দেন কালচার আমি কি করব, কালচারে সেম থিং, চকলেট আগার অর ব্লাড আগার, চকলেট আগার, as enrichment is required, so blood or serum is added in the blood agar. চকলেট আগারটা কি, চকলেট দিয়ে বানানো হয়, ঠিক আছে, when blood agar is warmed to some degree, 70 degree, etc., then the color is changed like chocolate, then this one chocolate agar. Then blood agar type, যখন heat করা হয়, then it is chocolate agar. It is specific for this complicated development. Okay. আর কি করা হয়, আর স্পেশাল মিডিয়া, স্পেশাল সিলেক্টিভ মিডিয়া is modified thermobaric agar media, modified why it is modified thermobaric media আছে, modified কেন, we are adding here vancomycin, cholesterol, vancomycin polymyxin. No, vancomycin, cholesterol and nystatin. কেন আমি এগুলো ইউজ করলাম, কেন ইউজ করলাম, কারণ কিছু আছে মডিফাই করলাম কেন, কারণ ইউরিনটা ওখানে পেরিনিয়াল এরিয়া, ভ্যাজিনাল এরিয়া, অনেক অর্গানিজম ওর মধ্যে মিশে আছে। ওকে, তাহলে সবগুলো আমি চাই না, আমি শুধু মনোকক্কাস চাই। সো these vancomycin, these cholesterol will kill other organisms. ঠিক আছে, তাহলে বাকি কোনো কিছুই গ্রো করবে না, but it is not kill the, but this will not kill the GNP. Other organisms will be killed. Nystatin কি, অ্যান্টিফাঙ্গাস, ওখানে অনেক ফাঙ্গাস হচ্ছে, ভ্যাজিনাল এরিয়া তো অনেক ফাঙ্গাস আছে, সেই ফাঙ্গাসটা যদি গ্রো করে আমি এর মধ্যে ব্রঙ্কোস খুঁজে পাবো না। So to kill the fungus, nystatin is used. Now it is selective. এখন সব কিছু চলে গেল selective, only selectively monococcus will grow. Okay, so it is modified thermobaric. So it is important to mention this. And same thing, that is 5 to 10% carbon dioxide is required for it to better growth, and after growth Same colony, small, circular, armulated, and surrounding is granular margin and grayish in color, etc., etc. And after the taking the colony, we will again go for downstream by like box constitute. I can see like how many people. Next, we go in the microbiology. Same thing, oxidase positive, catalase positive. Oxidase positive, catalase positive, and biochemical effect আমি কি বললাম ম্যানিটল মনে রাখবে এই ফর এ মেনিনজাইটিস ইজ ফার্মেন্টস ম্যানিটল কিন্তু এটা ম্যানিটলকে ফার্মেন্ট করবে না আর ডিপেন্ড করতে হবে ম্যানিটলকে ফার্মেন্ট করবে না তাহলে এটা মেনিনজাইটিস না কনফারেন্স ঠিক আছে লাস্টে তোমার পিসিআর মেনশন করতে হবে মলিকুলার ডায়াগনস্টিক মেথড এন্ড তারপরে অ্যান্টিবায়োটিক করা যাবে অ্যান্টিবায়োটিক আগের মতো হচ্ছে কি ইনারভিং ভিডিও বহু আদিম যুগ থেকে লাইক সিফিলিস মানুষের এই ইনারভিং আছে তাই শুরু থেকেই পেনিসিলিন ইউজ করা হচ্ছে আর প্রলং ইউজে কি হবে ড্রাগ রেজিস্ট্যান্স হয় ব্যাকটেরিয়া বাঁচার জন্য রেজিস্ট্যান্স করে দেবে এখন পেনিসিলিনের কোনো কাজ হয় না ঠিক আছে পেনিসিলিনের কোনো কাজ হয় না তাহলে নেক্সট যেগুলো কি আছে থার্ড জেনারেশন সিফালোস্পোরি দ্যাট ইজ ceftriaxone ceftriaxone then ciprofloxacin tetracycline এগুলো ইউজ করা হয় কিন্তু প্রবলেম হচ্ছে এটা ভীষণ কমন ডিজিজ অতটা লোকে এটা হাইড করে বলতে চায় না নিজের মধ্যে সেটা স্প্রেড করে তার পার্টনারের মধ্যে স্প্রেড করে যায় কিন্তু বলে না এইভাবে আস্তে আস্তে কি হয় একটা নিজে ট্রিটমেন্ট করে এরকম করে ভীষণ ভাবে ড্রাগ রেজিস্ট্যান্স হয়ে গেছে মনোকক্টাসি এখন মনোকক্টাসি মাল্টি ড্রাগ রেজিস্ট্যান্স মেনিনজাইটিস এই প্রবলেম নেই মনোকক্টাসি কি হচ্ছে মাল্টি ড্রাগ রেজিস্ট্যান্স অনেক ড্রাগ আর কাজ করে and HDR also extended drug resistance মাল্টি পরও যেসব ড্রাগ আছে তাতেও রেজিস্ট্যান্স হয়ে গেছে ঠিক আছে and এটা আমরা যদি প্রাইভেট পার্টে হয় আমরা সেটা হাইড করি এই জন্য এরকম তাহলে কি হচ্ছে কিন্তু ওয়ার্ল্ড ওয়াইড প্রবলেম সেই জন্য ওয়ার্ল্ড হেলথ অর্গানাইজেশন সিডিসি এর নাম শুনেছো সেন্টার ফর ডায়াগনোসিস সিডিসি ওয়ার্ল্ড হেলথ অর্গানাইজেশন এরা কি করেছে একটা রেজিমেন্ট তৈরি করে দিয়েছে কি বলা হয় যে ইট ইজ venereal disease এর সঙ্গে আরেকটা অর্গানিজম কমনলি অ্যাসোসিয়েটেড দ্যাট ইজ ক্লামাইডিয়া ঠিক আছে ক্লামাইডিয়াল ইনফেকশনও যার মনোকক্টাস আছে তার সঙ্গে ক্লামাইডিয়াল ইনফেকশনও দেখা যায় সেই জন্য কি করছে ওয়ার্ল্ড হেলথ অর্গানাইজেশন একটা ড্রাগ ঠিক করে দিয়েছে সেটা হচ্ছে থার্ড জেনারেশন cephalosporin and azithromycin that is ceftriaxone plus azithromycin combination ঠিক আছে it is two combination so ceftriaxone আর একটা থার্ড জেনারেশন হচ্ছে সালফেক্সাইড প্লাস azithromycin এটা দেওয়া যেতে পারে না হলে doxycycline 100 mg BD for 7 days doxycycline 100 mg BD দিয়ে দেওয়ার পরে 7 দিন দিয়ে পুরোটাই ক্লামাইডিয়া and microbial infection will be removed and it is good recommendation okay and prophylaxis meningitis meningococcal meningitis for anatomy you know the structure other positive events like meningitis meningococcus hemophilus infection is very young and unvaccinated streptococcus pneumoniae and it is also very important for newborn for up to adult so streptococcus pneumoniae you can see gram-negative nucleotide. This is capsule, always in diplo form, and there are 13 cell groups. That is A, B, C, etc. A, B, C, W135, E29, and X, Y, Z, S. 13 total. Other one you will know, E. coli I have told, beta hemolytic streptococcus, staphylococcus aureus, staphylococcus epidermidis, listeria also. Transmission primary mode is respiratory droplet. Every close contact বাচ্চারা স্কুলে যাচ্ছে মানে হাঁচি কাশির সঙ্গে ড্রপলেট দিয়ে যাচ্ছে pathogenicity. Meningococcal transmitted droplet reach nasopharynx, colonized person, and multiply on the mucosal cells of nasopharynx, and it will enter bloodstream. Which is what meningococcal. Ultimately, it will reach the CNS will cause meningitis, but before that, meningococcal may produce some symptoms, and there is also Waterhouse prediction syndrome also. You know it. Now, symptoms: headache, photophobia, stiff neck, convulsion, vomiting, septicemia, rash. Other symptoms are that is headache, post-pregnancy, hypertension, bradycardia also, bulging fatigue, coma, cerebral acidity, hernia, and if you do not treated, death. This is in C, group A, B, C, W, 135 and 5. You can see again same picture, diplo and the capsule. This is Waterhouse prediction syndrome. Critical occurrence. You can see the neurologic spot. This is made from Waterhouse prediction syndrome. After the vision, after the diagnosis for a problem, and quick progress of the disease, বাচ্চাদের কিছু বোঝার আগে তার ভেতরে এতগুলো স্টেপ করে যদি ইজ নট ইমিডিয়েটলি may lead to death. Cardiac sign, Buddhistic sign. So lab diagnosis, CSF examination, bacterial antigen diagnosed by CIP, counter-current immunoelectrophoresis, latex administration from the supernative field. Okay. Lumbar puncture, between third and fourth, lumbar puncture. তোমরা দেখেছো lumbar puncture? দেখেছো? হ্যাঁ, outdoor বা ward area. And he has says that pressure বেড়ে যাচ্ছে, WBC count is high. আমরা গান স্টেপ করব, প্রচুর WBC দেখতে হবে। আর কি হয় এতে বায়োকেমিক্যাল টেস্ট করব, সুপারনেটুরাল দিয়ে আমরা বায়োকেমিক্যাল টেস্ট করব, প্রোটিন উইল বি হাই। CSF এর তিন জিনিস দেখতে হয়, প্রোটিন, protein, sugar and chloride. Protein, sugar, chloride. আমাদের নরমাল টেস্টে জানতে হবে protein হচ্ছে 20 to 40 milligram per kg. Protein sugar is 40 to 80 milligram per kg and chloride is 160 to 120. Chloride কাছাকাছি। তাই এখানে যখন মেনলি কি হয় protein is high. Protein is high, WBC count is high. এই যে বলছি প্রোটিন ছবিটা ভালো হয়নি সরে গেছে প্রোটিন ইজ ইনক্রিজ বাট গ্লুকোজ ক্লোরাইড নরমাল আর এভরি antibiotic cefotaxib ciprofloxacin vaccine বলেছিলাম vaccine দেখো available for group A C W 135 and 5 কিন্তু বাকি যে 13টা তাদের কিন্তু এগেইনস্ট ভ্যাকসিন তৈরি করা যায় না শুধু এই কটার এগেইনস্ট ভ্যাকসিন করা যায় and vaccine and only against A only against C only W135 only Y যেটা Y এর এগেইনস্ট কিন্তু A এগেইনস্ট কাজ করে now one of us American fast. Yes, sir. Nice already. দেখতে পাচ্ছেন WBC এই যে ভালো ছবিটা ভালো হয়নি ডিপ্লোকক্কাই প্রেজেন্ট টাইম ইন্টারসেলুলার ডিপ্লোকক্কাই this is a neutrophil neutrophil এর মধ্যে একটা ডিপ্লোকক্কাই আছে intracellular diplococci these are the villi so one negative cocci it has villi granulate filamentous appendages outer membrane is composed of proteins phospholipids LPS LPS এর জন্য endotoxin টা থাকে outer protein যেটা বললাম wall protein opa protein Female parts, you can see these are fabrics and material that the animals. This is molecular technique. The tissue involved in this of female, cervix, urethra, rectum also, pharynx, conjunctiva. So, pathogenesis is a venereal disease by sexual contact, urine discharge, and complicated stricture. Stricture means urine humidity, urine the severe pain. It is the main problem. Stricture. It is the main problem. Prevent vascular gland you can see. So there is higher discharge and dyspnea. Vascular gland is vascular gland. Then the infection also in vascular gland. There is pelvic inflammatory disease and stability. Antibiotic stability. Oral infection. Okay, that was changing in sexual practice and oral sex. So oral infection. Ophthalmia and nephritis. Ophthalmia and nephritis. Eye infection. Ophthalmia and nephritis. Nephritis with severe fluid discharge, fluid periorbital edema, visual fluid topical application of 1% silver nitrate. 1% silver nitrate topical application আমরা লোকাল দিলে কি হবে? Three important words. Antibiotics is three important words occur in condition of poor hygiene. Poor hygiene condition. Transport assessment. towards transport mediate করে and in case of hydrogen swab may be impregnated with charcoal. Charcoal impregnated or যদি swab না হয় the cocktail will be preserved. And here it is taken to the towards transport. তারপরে laboratory helping check intracellular form and some data form or a cocktail so it is intracellular you can see cell মধ্যে আছে you can see 5 to 10% carbon dioxide 5 to 10% carbon dioxide small numbers constituents highly amputated finely granular surface this is the column and selective cano usually vancomycin polystyrene respective high media and chocolate micrometer oxidase quality dominated আবার দেখো সুন্দর পিকচার দুটো কনসেপ্ট দুটো একসঙ্গে আছে বুঝি মানছে present method is here drug conjugation protein is set reaction certified takes look in the north secret the cycle so antibiotic resistance